pregnant women, it's in every pregnancy between 28 and 32 weeks, or in the third trimester if you've missed that time. And the reason is so that we can maximise the antibody transfer, because we know that with the whooping cough vaccination that the antibody levels do wear off quite quickly. And so often by about 3 to 5 years, the amount of antibodies left from your last booster are going to be very, very low. And so we're just giving this baby the chance to get a maximum boost of antibodies to help it protect it in the first couple of weeks.